We're all here for you, but we need you all to be here for us.
We're tired. We're exhausted.
We're all taking care of more patients than we ever have.
I would never in my wildest dream would have imagined that we would be here again.
It's the great resignation hitting the healthcare industry at the worst possible time.
How many people did you see leave?
Out of my group of 8, there are 2 people left.
Nearly 1 in 5 healthcare workers have quit their job during the pandemic. Peter Sidhu is one of them. He left his job as a California ICU nurse in April of last year.
I was scared. We were going to a workplace where 1, we weren't going to have enough staff. 2, we weren't going to get our breaks. And 3, you were most likely going to see or witness some kind of a death.
Burnout is one problem, among others.
I felt that nobody had our back. For years now, we've talked about staffing. But COVID's been around for 2 years, and what have they really done?
Data shows as many as 54% of nurses and physicians were already burned out before the pandemic even began. Now, healthcare workers are leaving in droves for higher paying jobs, better benefits, and more opportunity.
Is this only going to get worse?
If nothing is done, I am concerned that this will get worse.
Vineet Arora is in charge of training the next generation of doctors at the University of Chicago.
Either you decide that you're going to stay in your job, but you have to care less just to get through the day, or you leave your job.
Those resignations, plus workers out with COVID, are causing major problems. Almost a quarter of hospitals nationwide reporting a critical staffing shortage, prompting calls for change. Nurses from D.C. to California picketing to demand better working conditions.
What can be done to fix this?
Canceling educational debt, loan repayment programs, regulatory relief so that we can train more physicians and nurses, improvements in safety in workplaces.
Solutions to stop the bleed before it's too late.
We're not firefighters. We're not in the military. We're not the police. We are healthcare workers. And now we're losing our lives and we're losing our careers.
All right, Priscilla Thompson joins us now live in studio. Priscilla, I know you've been all over this healthcare worker issue. We were also talking about earlier in the week some healthcare workers who have COVID who are being asked to work and treat patients. And now we have a new story on our website, NBCnews.com. And this is almost hard to believe. They're asking people who get sick with COVID, healthcare workers, to take vacation days when they're sick.
Yeah, Tom, as the policies around when healthcare workers can return to work after testing positive are changing, so too are the policies around how and whether they are going to be paid for taking that time off for COVID-related issues. And what my colleagues on the digital team have found in talking to healthcare workers around the country is that some of them are being asked to use their vacation days, to use their paid time off. And of course, they are not happy about that. And so we're talking about this shortage. We're talking about healthcare workers feeling undervalued, underappreciated, and that is certainly not helping.
It is such a mess. Priscilla, thank you for this story.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.